thank you very much, Josephine, for inviting me and for allowing me to spend some quiet time in the beautiful town of Burghausen to do some writing and some research. So I'm really delighted to be here to meet all of you. And I wanted to just follow what Dr. Schoonby just said about non-communicable diseases and metabolic health. He talked a lot about diabetes and being overweight and high blood pressure and things that many of us are familiar with. He also mentioned a couple of times, I don't know if you noticed, he mentioned dementia and he mentioned Alzheimer's disease. So I'm a psychiatrist. I've been practicing psychiatry for more than 20 years in the United States. I trained at Harvard University, and what they taught me and all of my colleagues at Harvard was that mental health conditions like depression and anxiety and Alzheimer's disease, bipolar disorder, all types of mental health conditions, whether they were minor or major, were due to chemical imbalances in the brain, and that these chemical imbalances needed to be corrected with medication. And so for many years, at least 10 years, I practiced the way most psychiatrists do. I talked to patients about their life and about their childhood and formed a relationship and wrote prescriptions. And that's what I did for at least 10 years. And I still prescribe medications, but I have to tell you a big change happened in my practice about 10 years ago when I began studying nutrition. Because what I noticed in my practice, and what most psychiatrists around the world notice, is that our practices, the medications can sometimes help. They can sometimes help. It depends on the medication and the person and the condition. But very often they do not help. And sometimes they do not help at all. Sometimes they only help to a small degree. And even when they do help, they often cause side effects. Sometimes very serious side effects, sometimes a lot of weight gain, 60, 70 pounds, or maybe 40, 50 kilograms of weight gain in some cases, and sometimes sleepiness, sometimes type 2 diabetes, and sometimes high blood pressure. So you're noticing a connection that sometimes the medications that we use to try to correct these chemical imbalances in the brain can cause metabolic problems. And so, and the diets that we eat can also cause metabolic problems, as Dr. Schoonby was talking about. So in any case, what we're noticing in our practices is that our practices were gradually filling up with patients that weren't getting better. And we didn't really know what to do about that. It's really frustrating as a physician to be trying your best to help people, and most of them are not improving very much. And it's actually really heartbreaking sometimes. So when I started studying nutrition, maybe 12 or 13 years ago, I noticed something very interesting, which was that most of what I thought I knew about nutrition was wrong. And, in 4 years of medical school, I think we had about 2 hours worth of nutrition education. And in 4 years of psychiatry residency, specialized training, we didn't talk about nutrition once. So I never thought about how food might affect our brains. It never occurred to me to think about that connection. And in fact, the way psychiatrists are trained is to think of the head as separate from the body. But of course, most studies do agree that the head is part of the body. And so all of the things that can affect the body in a negative way can also, of course, negatively affect the brain. So how does poor metabolism, how does bad metabolic health affect the brain? It's very interesting. I've come to really understand that these chemical imbalances that we were taught about in medical school and in residency, medications are not the most powerful way to correct them. What I have come to understand is that the most powerful way to change brain chemistry is through food, because that's where the brain chemicals come from in the first place. So there is a lot you can do without medication to improve your mood, to improve your energy level, to reduce your risk for memory problems later in life. It's not normal for children not to be able to concentrate in school. It's not normal to become depressed for years and years. It's not normal for your brain to begin to deteriorate as you become older. These are not normal. If we eat properly, we can prevent most of this from happening. So, and I know this because I changed the way I practice about 10 years ago, and I started incorporating nutrition principles into my practice, science-based nutrition principles. So we never asked in medical school or in psychiatry residency, what causes these chemical imbalances in the first place? It just never came up as a question. And there are many different ways that the way we eat can cause chemical imbalances, but one of the most powerful ways is through this phenomenon, this very common phenomenon called insulin resistance, or insulin levels that are running too high too often. And the thing that causes insulin levels to run too high too often is eating too many of the wrong carbohydrates too often. It's really mostly that simple. And so if we pay attention to the types of carbohydrate, the quality of the carbohydrate, and the amount of carbohydrate in our diets, we have a tremendous influence over our insulin levels. We can bring them down into a normal range. So what a ketogenic diet does, or ketogenic metabolic therapies do, is they bring those insulin levels down into a normal, healthy range. They bring your glucose levels down into a normal, healthy range. The brain loves that. And the reason the brain loves that is because, you may know, the brain needs a lot of energy. It's a very high energy electrical organ. So, it does need glucose, it does need carbohydrate. It doesn't have to come from the diet, which I'll explain in a minute. But the brain is, there's a researcher in Canada, Dr. Stephen Cunnane, who describes the brain as a hybrid engine. It can run entirely on glucose from your blood sugar, or it can run on a mixture of glucose and ketones. So ketones are created when you lower your carbohydrate intake enough so that your fat-burning systems will turn on. You start burning fat, and when you burn fat, ketones are created, and those ketones can cross into the brain and help fuel the brain. So the brain actually loves to use a mixture of glucose and ketones rather than using glucose all the time. So the problem with eating a diet that has a lot of sugar and flour and liquid sugars and powdered sugars is that when you eat that way, which is not the way we evolved to eat, what you get is these unnaturally steep spikes and dips in your blood glucose level. It comes up way too high, it comes down way too low. It destabilizes your metabolism. And whenever your blood glucose goes up, your brain glucose also goes up. And if it goes up too high, it causes damage inside the brain. So the less you do that, the more protected your brain will be. So I started practicing in a way that incorporated some of these principles about 10 years ago by simply asking people at first just to eat a cleaner diet, a whole foods diet, without the extra processed sugars and flours and juices and breads and things like that. And that made a big difference for a lot of my patients. But for those with more damaged metabolism, which is now many of us, including myself, it wasn't enough. For those patients, they needed to really go to an extra, they needed to do something extra, which was bring the carbohydrate down low enough so that we could really see ketones being generated in the blood, and you can measure these in the blood. And when you do that, the brain begins to function better because the brain then has better access to energy. So when I started practicing this way, I started noticing some things I'd never seen before. People being able to reduce the amount of medication they take, sometimes being able to completely come off all of their medications, even some very serious mental illnesses, people with even schizophrenia, bipolar disorder, early Alzheimer's disease, being able to reverse those symptoms and come off of medication. And this was, to me, truly a miracle. I mean, I'd never seen anything like this before in my practice. So I began studying it more deeply, writing about it, speaking about it, meeting other people around the world who were learning about these approaches. It's really a very powerful medical intervention, and very simple and safe if you know how to manage it properly, which I can talk about in a minute or during the panel if you like. So in any case, I decided that I wanted to spend the rest of my life working in this way, studying this way of eating, helping other people understand it, and practicing in this way. So what I'm doing here in Burghausen is several years ago I attended a Food for Thought conference, really a groundbreaking conference in Zurich, where I met Dr. Schoonby. And Josephine Barbarino was there, and she came up to me and said, you know, I'm going to begin this new conference in Burghausen. Would you come and speak? And of course, I was delighted to say yes. And so that was the first conference where I was able to meet a truly international group of speakers, from all over the world, different disciplines. And since then, I've continued to write and research and work, practice. I train other psychiatrists how to use these therapies in their practices, practitioners from all around the world. It's a virtual program. And I've started writing a book, and this book is really intended for the general public as well as practitioners to help people understand the basics of nutrition. So there's a lot of surprising things about nutrition that most people, that I certainly didn't know, and then how to use certain dietary changes to improve your mental health and protect your brain health over the lifespan. Some of these strategies are very simple, and others may involve ketogenic metabolic, a diet that puts you into ketosis. And so it will be part science of nutrition and part how to do this at home or with your local physician, helping people really understand how they can take their own mental health into their own hands. The reason I love practicing this way is because it's empowering. It's not the doctor saying to the patient, you have this illness, I'm going to give you a prescription, come back in 4 weeks, and we'll see if we need to change the dose. It's me having a conversation with another human being in the room and saying, let's see what we can do together to improve your metabolic health, which also improves your brain health. Let's see what's possible together. And this puts the control back in the hands of the other person. It's a completely different feeling, and it's a really good feeling. So another thing I've done, which I'm very, very excited to share with you, is just last week, we were able to get a paper accepted, a journal paper, academic paper with a colleague of mine in Toulouse, France. Dr. Albert Danan is a psychiatrist who's been working for 35 years with people with chronic mental illness in Toulouse, France. And he saw that his nephew, his brother's son, had improved on a ketogenic diet. He had autism and epilepsy, and he noticed that his nephew began to improve within just a few weeks on a ketogenic diet. He was so impressed by that, he started thinking, I wonder, so this diet appears to be good for the brain, I wonder if this could help my patients. Some of my patients that I've been working with for 20, 30 years who even, no matter how hard I try, they're not getting better. So he put 31 of them into a hospital, a psychiatric hospital in Toulouse, put them all on a ketogenic diet. These are people with severe bipolar disorder, severe schizophrenia, and major depression. All of these patients improved on this diet. Their metabolic health improved. Almost all of them lost weight, and all of their psychiatric symptoms improved. We are not talking in this particular study about complete 100% cure. We are talking about improvements that he had never seen before in any of these patients, despite working very hard to help them. So we know that these these philosophies, these metabolic approaches are powerful. We know that they can work. We need more research. There's more research coming. One of the most exciting talks I heard a couple of weeks ago in Burghausen was Dr. Ian Campbell and his father, Dr. Harry Campbell, in Scotland. They're running a clinical trial for ketogenic diets in bipolar disorder. And we are going to see, I am sure, really, really good results from that work. And so I think it's a really exciting time to be focusing our efforts in a new direction. Things have not changed in psychiatry treatment since the 1950s, really, when psychiatric medications became available. And it's really time to move in a new direction. I'm really excited to be part of this group. And during the panel, we'll be happy to answer your questions. If you have family members or you yourself have questions about anxiety, depression, attention problems, dementia, we're happy to talk with you and during the intermission as well. So thank you very much for your attention, and I look forward to talking with you all later.